Hey guys, you're watching With the Doctor, and I'm your host, Dr. Abhishek Papneja. And do you have back pain? Because I do. I've got a herniated disc in my neck from C4 till C7. I've got lumbar herniations and I got sacral herniations, right? But right now, I am completely functional. What did I do to get to this point? I use yoga as a therapy, right? So how do we use yoga to fix these herniations? So that's what we're going to be focused on, and we're going to do it step by step. So first of all, let's fix this neck problem right here. So normally the neck is supposed to be like this. You can see the elongated neck, and it's tucked in at the back like this, right? But what do we do in our modern era? We're playing on our cell phones all the time. So what does that entail? That entails that we're looking down like this. Whether it's at school reading a book, whether it's working on a computer like this, or whether it is texting your boyfriend or girlfriend, right? What's happening? Our shoulders are coming up. When the shoulders come up, we compress the cervical spine, right? Our head tilts down, so what do? We put axial pressure forward. And there's some scientific research that states that you can actually be putting an amount of 90 pounds of stress at your cervical bones. So ideally, what you want to be is in this position where your shoulders are rolled back, right? Your neck is tucked in and it's parallel to the ground, right? So that is ideal position of the neck. If you can get it into that position, you'll start feeling a relief in pain. But how do we get to that point is what we're going to be focused on right now. So you guys, all I've heard of is the corpse position. So normally what we do is we just lie down on the ground and relax, called Shavasana, right? But no, that's not how you're supposed to do it. It is actually a very active relaxation pose. So normally what happens is that we're told to go into this corpse position and we just lie down. So in this position, what is happening? I am getting an extension of my neck. And in this extension, I am compressing my cervical spine right here. What's happening is that my vertebral bones, instead of being elongated, they're compressing backwards with the extension, and the disc is herniating through the hole right at the nerve root. And that's creating a radiculopathy where the nerve root is being stressed out. So what I really want to do is I want to take my hands like this, put them up, come up here, and then put one vertebrae down at a time. Keep the neck tucked in the entire time, and then relax. You can see I got a double chin going here. That's because I got my neck tucked in. If you want a better result of this tuck, all you got to do is grab your head, tilt it up, hold that tilt, and elongate the cervical spine. Then you take these hands, rotate it this way so your shoulder opens up, and you drop it down right beside your body. Rotate the hand and drop it down. So this will open up the shoulders here, and your neck will be opened up. Now what you want to do is you want to hold this pose for about 5 to 10 minutes. In the beginning, you will feel a lot of stress that you're doing something wrong, but don't worry, what's really happening is over the years, your tendons, your ligaments, and your muscle fibers have shortened up. So what we're doing now is we're creating an elongation to relax those tendons, muscles, and ligaments and put the bones into natural position. So this posture right here for 10 minutes per day, once a day or twice a day, will fix your cervical herniation. What else can we do to strengthen the muscles? To strengthen these muscles, what can we do? So let's just look at it logically. So we have a muscle that goes down this way, right into our upper back, right? So when we have neck pain, you would also notice that you have upper back pain, a thoracic pain, right? So what you want to do is, again, we'll go into a pose called Parvatasana. What is Parvatasana? So Parvatasana is basically called a mountain pose. So from the side, this is how it will look. I'm raising my hand. Neck is tucked in, as we discussed before. Remember, neck is tucked in parallel to the ground. Middle fingers, hand, the palm facing forward, middle finger touching the ground. We're going to breathe in, and we're going to raise the arms up. And when you're raising the arms, remember, we're keeping the shoulders down in the socket, right? Keep your shoulder blades contracted at the back, pulling the shoulders down. We don't want is this. We don't want to compress the neck by raising the shoulders. Sometimes you can use this posture to decompress the neck, but ideally you want to do this pose. So in this pose, what we're doing is we are not interlacing the hands. We are raising the hands straight up with no interlace. We are rolling the shoulders down, the shoulder blades down, and keeping the rhomboids and the posterior muscles contracted. At the same time, we're going to contract this elbow muscle to raise the elbow straight, and we're going to contract the bicep muscle and triceps as well. The biceps will bring the arm closer, and the triceps will pull the arm down. So we want to pull this arm down, and we want to pull the elbow up. You want to hold this posture for 2 minutes if you can, but you can go with intervals of 15 seconds and then exhale to relax. So we're going to do it from the front as well. So take your hands, palm facing forward, neck tucked in, parallel to the ground, middle finger touching the ground. We're going to inhale and raise, and we're not going to raise the shoulders out of the socket. We're going to keep the shoulders down in the socket. Posterior muscles are contracting, shoulder blades are together, contracted. Hands are not interlaced. They are in prayer position at the top. And you're going to hold this pose for about 2 minutes again. So these two techniques right here will resolve the neck pain that you're experiencing. And the next pose, what we want to do is we want to better control that shoulder blade muscle. So what we're going to do is we're going to do you see what I'm doing? So what we're going to do is we're going to put our hands, palms facing forward, and we're going to push the chest in and the upper back backward. And then we're going to reach out. Now we're going to pull the chest out, and we're going to pull the hands in. Push the chest in, pull the chest out. This movement, where you're pushing the chest in or the back out, and then we're going to pull the chest in, you're working the shoulder blades right here. So why is that important? It's important because these muscles, when they're strong, they pull backwards. That's their that's the tendency of the muscle over there, is to pull backwards. So when it pulls backwards, it's pulling your neck backwards. And that will give axial strength to your neck, which will resolve any neck problems that you're experiencing. Whether it is a muscle tear, tendon issue, ligament issue, herniated disc, spinal column compression, or a nerve root compression. All of these are going to be tackled with these postures. So until next time, if you haven't already subscribed, please hit the like and subscribe button at the bottom, and stay tuned for my next video.